Bony landmarks for the carpometacarpal joint are the radial styloid process, the first metacarpal, the second metacarpal, the palmar aspect of the CMC joint, and the crease of the little finger. We'll first start by testing carpometacarpal flexion. To do this, the patient is in sitting with their forearm and hand resting on a supporting surface, wrist in neutral flexion, extension, and radial and ulnar deviation. The radial ulnar joints are in full supination, CMC joint in 0 degrees of abduction, and the first MCP and IP joints are in slight flexion. We will stabilize the carpals, radius, and ulna to prevent wrist motions. We will then assess the end feel by moving the thumb through the motion. The end feel should be soft or firm. We'll then ask the patient to move her thumb through flexion. We will line up the goniometer with the fulcrum being on the palmar aspect of the CMC joint, the stationary arm being with the radius and the radial styloid process, and the moving part with the anterior midline of the first metacarpal. We'll then take our measurement. For first carpometacarpal extension, we'll have the patient in sitting with their forearm and hand resting on a supported surface, wrist in neutral flexion, extension, and radial and ulnar deviation, radial ulnar joints in full supination, the CMC joint in 0 degrees of abduction, and the first MCP and IP joints in slight flexion. We'll stabilize the carpals, radius, and ulna to prevent wrist motions. We'll then passively move the patient through first CMC extension to determine the end feel. The end feel should be firm. We'll then ask the patient to actively perform CMC extension. We'll then line up our goniometer, the fulcrum being on the palmar aspect of the CMC joint, the stationary arm being on the radius and the radial styloid process, and the moving arm on the anterior midline of the first metacarpal. We'll then record our measurement. First carpometacarpal abduction, we'll have the patient in sitting with her forearm and hand resting on a supported surface. The wrist is in neutral flexion, extension, and radial ulnar deviation. Radial ulnar joints in neutral supination and pronation, and the first CMC, MCP, and IP joints are at 0 degrees of flexion. We will stabilize the carpals and the second metacarpal to prevent wrist motions. We will then passively move the patient through first CMC abduction and determine the end feel. The end feel should be firm. We will then ask the patient to actively perform that same motion. We'll then line the goniometer up with the fulcrum being on the lateral aspect of the radial styloid process, the stationary being on the lateral midline of the second metacarpal, and the moving being on the lateral midline of the first metacarpal. We will then record the measurement. Carpometacarpal opposition. We'll start with the patient sitting with her forearm and hand resting on a supported surface. We'll place the forearm in full supination and the wrist in 0 degrees of flexion, extension, and radial and ulnar deviation. We will stabilize the fifth metacarpal to prevent motion at the fifth CMC joint and wrist. We will grasp the first metacarpal and move it away from the palm of the hand, and then move it in an ulnar direction toward the base of the little finger, allowing the first metacarpal to medially rotate. We'll then have the patient perform the same motion. We'll line up our goniometer from the linear distance between the tip of the thumb and the center of the proximal digital crease of the little finger and take our measurement.